improved. It hasn't changed. And we used to think people outgrew these. Now we know as you get older, it sometimes gets worse because you don't have your parents, you don't have the structure of school, life gets more complicated, you have kids and a job and so on and so forth. So that's what we think the biggest disadvantage is that it doesn't have a lasting effect. And I work with lots of adults with ADD that were given Ritalin as a child. They didn't stay on it. Back then we thought kids outgrew it. So with autistic spectrum disorder, I only have one slide. As there has not been any medication developed specifically for autism or Asperger's yet, although they're working on it. They've approved Risperdal, which is one of these new atypical antipsychotics. But what most of the doctors do is they try to treat the symptoms. If a child's hyperactive, they'll try a stimulant. But so many of these autistic kids are over-focused, it doesn't work. If they're really anxious or over-focused, they'll try an antidepressant like Prozac or Lexapro, or sometimes they try Risperdal or Abilify. Some of these antipsychotics, they're newer, they have less side effects, but they can still have pretty severe side effects. There's a lot of weight gain associated with the antipsychotics. One of the newer research they've been doing with Risperdal is that they found out that Risperdal increases female hormones in the body, and if you're a boy, especially an adolescent, it's kind of interesting. It actually leads to breast enlargement. And I was just reading an article this weekend where there's adolescent boys that have taken Risperdal that actually have to have breast surgery because they get enlarged so much they get teased. And there's a specific name for it, but it is something at UCLA they've been studying it too. Luckily, these are pretty rare, but there hasn't been a medication associated for it, and I don't think it's going to happen right away because we've already found 6 patterns of autism and different patterns of Asperger's. They may need 7 different medications. So that leads me to what I want to finish up with, the neurofeedback. The neuro is the brain, and feedback is the information you get from your environment. This is the computerized therapy that we talk about on the doctor show. This is a non-drug treatment that has a long-lasting effect. With ADD, in the studies we've done, we've seen 10-year follow-up that's successful in 90% of the cases, and 5-year follow-up in some of the studies that Dr. Lubar and Dr. Monastro have done. The success rate is much higher than medication. With ADHD, it's between 80 and 90% in the studies that have been out. With autism, as I'll show you, neurofeedback has the highest benefit to harm ratio of any treatment that's been studied with research yet. The research with neurofeedback actually started in California in the 1970s, and they started neurofeedback treating epilepsy and seizure disorders, and they were actually able to get adults off their seizure medication by doing the neurofeedback. Dr. Lubar, who trained me, came out here in the 70s, studied at UCLA, and went back to the University of Tennessee and started working with hyperactive kids, and I started working with him in the 80s. And these are some of the studies that are involved, including a study I'll tell you that we did, but about 35 studies. How many of you are familiar with neurofeedback? Some of you are. That was what, in the doctor's video, that's what we show at the end. But let me explain what this is. Based on the brain map, we put the sensors in the area of the brain that's in balance. So this is the right area of the brain. This could be for ADHD or for Asperger's. Now, we're not putting anything into the brain. This is a feedback loop. We're reading the brain waves 1,000 times a second, and then slowly they go into an amplifier. The amplifier slows it down and runs it through a computer. This is a 10-year-old slide, by the way, so this is an older set. Now our amplifiers are this big, and our screens are obviously different. But what the computer does is every second it gives you information about what brain state you are, but it's in the form of a computer game. So the students play computer games with their brain. There's no joystick, there's no keyboard, and by doing these games, it trains their brain to be in the balanced state. So I'll explain what that is in a minute. We only do the neurofeedback individualized one by one. Like I said earlier, the athletes call this mental fitness training. The difference is that there are some groups, there's some big groups that do neurofeedback. Since we started, when we started, we were the only one in California, in Southern California. Now there's a lot of them. Some places do neurofeedback in a group. and they have one technician working with 4 kids. But over 27 years, I found that students with ADD and Asperger's and autism do some very interesting things when you leave them alone with a computer and electrode on their head. Imagine what they may do. They take the electrodes off, they put them on their shirt, they put them in their mouth. The really bright kids go and they change the settings so they can leave early and go home. Or they write you these little creative notes in there. They close their eyes. So we only do it one at a time. We can't run as many people that way, but it's a therapy. It's a treatment. It isn't just the computer. The therapist is part of the feedback loop because we have to explain what students are doing. We have to prompt them. We have to coach them. We have to keep them motivated. So, you know, it's definitely part of the program is individualized. So what the students see or what the adults see is usually a training screen at first that has 3 different bars, and we usually train 3 brain waves at once. This is changing every second, like some of you may have saw in the doctor's video. They color code them, green for raise and red for go down. So the green one for ADD would be an attention brainwave. And we would try to raise that above a little line or threshold or goal we'd set. The middle red one is the daydreaming brainwave for ADD or distractibility. We're getting lower, the theta. And the one on the right would possibly relate to hyperactivity or impulsivity. And these little lines we set this individual for everybody. So everyone's levels are different. So what I tell the young kids for paying attention, this is like a high jump, and you want to raise your attention above the line. And this is like a limbo line, and you want to lower your daydreaming or your distractibility or your hyperactivity or impulsivity below the line. And we develop a strategy of how they sit still and how they try to block out distractions. And what happens is when they do all 3 things at once, they get a point and a beep, or music plays or a DVD plays, and that's the feedback from their brain being in the healthy, balanced state, depending on which direction they need to go. Now, if this was somebody with autism or Asperger's, this might be an over-focused brainwave that we're trying to lower, or an anxious brainwave that we're trying to lower. So it really depends on the setting. If this is a coherent setting, we're working on 2 parts of the brain, and we're getting them both to communicate at the same time. There's 50 different types of neurofeedback we can do about, and it's all based on that brain map. So there are some places that do neurofeedback that don't do brain maps at all, and it's kind of like guessing which one to do. So this is an adult who's doing neurofeedback, and she has a more complicated setting where she's raising one and lowering one, and this might be an animation or a game, or nowadays we have a new system that has DVD feedback. And after people learn how to do it with the bar graphs, the autistic and Asperger kids really like this, that their kind of feedback is a DVD, and as when they get their brain in the right state, the DVD gets bigger and louder. And when they over-focus, or if they fidget, or the DVD gets smaller, or it stops and the sound gets smaller, the lower. So they're kind of getting feedback, and they're playing the movie with their brain. And it will stop like right in the middle of a scene and just cut off the audio. So the kids, all they have to do is sit, and we kind of make it so they can be successful. And they're just, you know, playing the computer game based on their brain state, and we do it over and over and over again. What we know about our brain is our brain remembers things. It's not like our muscles, where if you go to the gym and you work out and you stop, it doesn't last, unfortunately. Wouldn't that be great? But our brain remembers things, and every time you learn something, your neurons increase. Your neurons are increasing tonight, by the way. Isn't that good news? But when we learn something, we do it over and over again, we generally don't forget. That's why we practice social skills, and we practice them, and we practice them at home and practice them at school. This is why those of you who drive, don't forget how to drive. If you go to New York and ride the subway for a year and you move back here, you're not going to forget how to drive. You might be rusty the first day. You're not going to forget. Or a child rides a bicycle. Once you do it over and over again, it's going to stick because your brain learns and learns. So we actually are strengthening the neural connections related to paying attention or being flexible, and we're weakening the ones for hyperactivity and attention, over-focusing, anxiety. And I'll show you what happens to the brain in a minute. So this is an older graph. We could have a game like Pac-Man, and as they pay attention, the lights are green, their brain's in the right state, they get more points. If they daydream or fidget or over-focus, it turns red, and it just